Hello and welcome to Let's Talk, a series of podcasts produced by the Hazelden Betty Ford Foundation on the issues that matter to us and the issues that we know matter to you as well. Substance use disorders, prevention, research, treatment, and recovery support. I'm your host, William Moyers, and today we're coming to you from on the road at the campus of the Betty Ford Center in Rancho Mirage, California, joined by my friend and colleague, Joseph Strzeski. Welcome, Joseph.
Thank you, William. Pleasure to be here.
You're the Executive Director of Medical and Professional Education, and our topic for today is preventing burnout in healthcare professionals. You mean to tell me that healthcare professionals can burn out?
It's hard to believe, William, but healthcare professionals can, in fact, burn out. Over the course of my career, and I'm sure over the course of your career and others, one thing I've seen more than ever is how hard healthcare professionals work. Day in and day out, we put in long hours. We're essentially surrounded by individuals who are suffering, who are living with challenges, and we're trying to help them see the light at the end of the tunnel. We're trying to help them find that resilience, find that happiness, find some balance in their lives so that they can be as productive as possible. And so one thing that I've really found important over the course of my career is working with healthcare providers that are stressed out, that are burned out, because I quite frankly don't want to see them resort to unhealthy habits. I don't want to see them have to end up in treatment if possible. I really want them to find some active balance in their lives based off of what they're doing in their workforce and then what they're doing with their families. And what I've noticed is, you probably see this in a lot of our settings, you see a lot of healthcare providers in treatment. I see lots of physicians, I see lots of nurses, I see lots of pharmacists, I see lots of physician assistants, I see lots of social workers, I see lots of addiction counselors, people that love helping others at a neglect to themselves. And so they're coming into the office early every day, they're on the computers charting outside of their small group and one-on-one individual session times, they're working late hours into the evening, they're going home taking care of their significant others, their children, and they're doing that over and over and over again. And why I found this so important is I work a lot of the time with family law lawyers and with judges. And in working with judges, I would watch them day in and day out in the courtroom, and what they would see in front of them were people that were living with addiction. It's like 80–90% of the cases presented in the courtrooms involved alcohol or drugs of some sort. And so here they were, they would hear these stories, and what would they do? They would go home at the end of the day and they would stuff the emotions and stuff the feelings and come back the next day and do it all over again. And they would live with things like vicarious trauma. They would live with things like sadness and remorse. They wouldn't get to see a lot of light at the end of the tunnel. It's not like individuals were coming back to the judges and saying, thank you so much, Judge. You really helped influence and impact me. They're usually not seeing individuals at the best of times. And so we started providing educational experiences for judges first and foremost to help them with sentencing people to treatment as opposed to sentencing them to prison or jail. As you know, drug courts have been incredibly successful over the years in helping not just reform people, but helping them get clean and sober and stay clean and sober. Then you would look at different professionals like clergy, right? People would go to their churches or their synagogues and they would share with individuals about their drinking and about their using. People that would run these churches or synagogues or other religious experiences would then stuff those emotions and listen to all these horrible things all day. And sometimes they would drink at the end of the day. And if you're a judge or a lawyer or a clergy person and you're hearing this stuff day in and day out and you start drinking, what are you living with? You're living with shame. You're living with guilt, you're living with remorse, you're living with secrets. And so we started seeing all this stress and some burnout in clergy and in judges and lawyers, and then you'd see your peers, your healthcare providers, working these long hours all day too, and I would see it in medical settings all the time too, and it would always start in the home, and they would try to keep it quiet, right? Significant others would try to cover up the addiction or cover up the mental health and illness. And then it would progress to the point where it would make its way to the office. And in the office, you're surrounded by support staff, you're surrounded by assistants, you're surrounded by others. doc didn't have any alcohol in his breath, that was from the night before, or, oh, he's got black circles under his eyes, doctor just works so hard here. So we had this underlying alcoholism and drug addiction that was taking place, and people were trying to cover it up over and over again. And the sad reality is that people would only seek help when they were caught, when they would actually have board action against them.
Consequences.
When they would have consequences. And so we started doing things like clinical diagnostic evaluations to help people get medical write-ups and psychiatric write-ups and clinical write-ups. We started talking to them about setting healthy boundaries and about taking care of themselves. We started sharing with them the consequences as to what could in fact happen if they don't stop drinking, they don't stop using. We started showing them other individuals that were going through the same struggles. I mean, if you work with healthcare providers and you put them in a group together, they tend to call each other out on their BS. They tend to hold each other accountable. They tend to be able to relate better. You have specialty groups nowadays like birds of a feather for pilots.
Yes.
Lots of pilots in treatment. You've got specialty groups nowadays called the other bar. Lots of lawyers in treatment. You've got specialty groups called caduceus meetings for medical professionals. And then you've got professionals groups for other individuals like police officers, like firefighters. I go to a lot of 12-step meetings. Let's say I have a loved one that's going into surgery tomorrow. If I'm sitting next to a surgeon that's practiced while under the influence and they're sharing about that in my 12-step meeting, I might be having second thoughts about my loved one going into surgery tomorrow. So we have these safe environments, these specialty meetings that are all over the world for people to share their stories as well. So in looking at our peer groups and looking at burnout and looking at stress and looking at addiction, which again is so prominent in our field and healthcare as a whole, we simply want to make sure that they realize there are resources available and that we're there for them.
And that it's okay to ask for help, right?
And that it's okay to ask for help because, here we are, we think we know everything, right? We think we have all the answers and all this training and all this schooling and I'm supposed to be the subject matter expert. How do I reach out for help, right? How do I go to somebody and allow myself to be vulnerable and allow myself to say, hey, you know what? I'm hurting right now.
And the fact of the matter is that it's okay to ask for help. I mean, oftentimes, no matter what it is, but particularly healthcare professionals or those who are successful in business or successful in law, they feel vulnerable in asking for help, right?
They do. And I think that they're afraid to ask for help and they don't realize that there are services available to them and it's not the end of the world. It's not the end of the world that they need to seek help for addiction. I've had medical students go through our programs, our Summer Institute for Medical students, whereby they're actually in treatment at our facilities, learning about addiction through the individuals living with it, who then go on to residency and end up back in our facilities as patients 2-3 years later.
Interesting.
And they look me in the eye and they say, Joseph, thank goodness I had that experience at your SIMS program because I wouldn't have gotten here this soon. I might have never thought I had a problem. I wouldn't have introspectively looked inward and asked myself some questions. I might not have sought help. I might not have realized that I wasn't so alone. And so we see that nowadays. We see, I don't know, 15, 20% of our patient population could be licensed healthcare professionals. Wow. And I'm proud of that.
Yes.
I'm really proud of that because I know that those individuals are going to have a profound impact on healthcare and on the world as a whole through getting help sooner than later.
Joseph, we only have a couple of minutes, but talk to me a little bit about the impact that the opioid epidemic has had on healthcare professionals, and I think specifically about those who are working in the emergency rooms or first responders who are out reviving people who are overdosing in the streets and so on. What has been the impact of the opioid epidemic?
So if you look at Hazelden, Betty Ford as a whole, right? 17 sites in 9 states right now, 24,000 patients we're going to serve this year. If you go and look at what they're diagnosed with nowadays, as far as substance use disorder goes, you're seeing opiates in like 30+% of our cases. That's a huge number. If you turn back the clock 10, 15, 20 years ago, it's 2, 3, 4 times what it used to be. You're seeing the same thing with regards to our healthcare professionals. When I see healthcare providers come on in and their primary diagnosis is an opiate use disorder, I'm not surprised anymore. I almost expect them to say alcohol use disorder or opiate use disorder because there's such ease of access to getting those opiates. A lot of times opiates are being overprescribed, so they're more readily available than ever. For a lot of our individuals that are healthcare providers, they have the financial means to continue to support their habits or their usage, so that happens as well. I mean, we go to George Washington University or to Washington, D.C. area all the time, and everybody's talking about opiates because they're killing people. I always viewed alcohol as the slow killer and opiates as the fast killer, and that's just so sad that we've classified them in a certain way, because at the end of the day, if people don't get help for these use disorders, they're going to die. Yes. You've got this progressive disease right now, and I think for healthcare providers, a lot of times we think we're invincible. We think we know better. We think we know how to prescribe these medications or how much we can use. We like to treat ourselves a lot of the time. I mean, here you've got an addicted professional who's treating others who thinks they can treat themselves at the same time. It's like the biggest oxymoron in the world. So I think our advocacy efforts are huge so that we can help other public health officials, President, National Institute of Drug Abuse, National Institute of Alcohol Abuse and Alcoholism, SAMHSA, MRSA, all the other large public organizations. I mean, their eyes have been opened, but more people continue to die than ever, and we need to do better, and we need to do more, and we need to do it now.
I know there are going to be people who are watching or listening to this podcast specifically because they know they have an issue or they have a family member who's a healthcare professional who has an issue. We've got 2 minutes. Give us 2 or 3 or 4 action steps that healthcare professionals can take to get help for themselves or for somebody who works in their office or their healthcare profession.
Yeah. My number one recommendation is it's never too late to get help. And you don't have to have this myriad of consequences. You don't have to get a DUI. You don't have to get reported to the board. You don't have to get caught. You can seek out help yourself. It's not the end of the world. Address the issue now, sooner rather than later, and move forward with your life, helping more individuals than you ever could have. So I really want people to realize that stigma is still alive and well.
Yes.
We look at people with substance use disorders at times negatively, like they're a hindrance on the world, and that's just not true. Individuals with substance use disorders are resilient people that want a better life for themselves and their families. So with our healthcare providers, I hope they see that. I hope they see and realize that if they get help sooner than later, they can help profoundly impact and influence thousands of individuals more so than they could if they continue to drink and to continue to use.
And the fact of the matter is that oftentimes, you know this, you've told me about this before, and we see it on the units. Healthcare professionals are among the group that has a very high success rate, right? Once they get into treatment, they have their rates of recovery are high, correct?
Healthcare professionals in particular is one area that we've actually done a really good job studying with respect to substance use disorders. A lot of other areas are lacking, but when it comes to individuals, primarily physicians and pilots, and we monitor them for 5 years for abstinence, you'll see 78 to 92% abstinence rates after 5 years, which is remarkable.
Because why, though?
Well, I think they have the licenses at risk.
Yes.
So a lot of times it's the job, but at the end of the day, my belief is that everyone's life is at risk. So people say to me all the time, well, of course the abstinence rate is going to be higher for people with licenses. It's their livelihood. Well, isn't it everyone's livelihood when it comes to substance use disorders? One drink, one drug, one event could in fact lead someone to their death. We need to treat this thing seriously and realize that these are our brothers and sisters out there, and if we don't take action and we don't take it now, we could in fact lose them, and that's a big deal. It's a very big deal.
Joseph Strzelecki, thank you very much for taking the time to share your incredible professional expertise and that remarkable articulate passion you have for these subjects. The Executive Director of Medical and Professional Education for the Hazelden Betty Ford Foundation. On behalf of everyone here at Let's Talk, I'm your host, William Moyers. Thanks for joining us again, and we'll see you soon.